In 2012, there was a delegation to Finland after Minister Stubb's visit to Kazakhstan. So it's 7 years after this delegation, where here are present persons who visited Finland and were the ones that launched whole this strategic collaboration. Why Finland was chosen as an example for nursing care development? We can see that there are differences in child mortality rates, where during last 20 years Kazakhstan advanced greatly from 50 to 10, but at the same time Finland from 7 to 2. What was the difference in last 20 years? Who were caring patients during last 20 years when the small but so important change was done? It was the nurses who are the main workforce. In Finland we have 4.7 nurses per physician. That is a difference between our system of healthcare and the Kazakhstani system. So therefore, Finland had opportunity to provide you assistance in developing nursing care. It's difficult to talk about only this last project which is ongoing and the last 2 years. It is a collaboration where we committed 7 years ago. Only during these last 2 years in SHIP project, I have had 22 Finnish experts to support Kazakhstan in this development process. So what have we been doing and what have we accomplished during these years? If I take now the capacity building of the teachers, so they are the key of the improvement of the education. We started with medical colleges in 2013-14. We worked with 6 pilot medical colleges. We trained them. Here you can see the results of 2 last years. I think we trained medical colleges teachers more. There was the critical mass of 30 teachers who really understood what is competence-based education. We have heard here how medical education has been improved and what kind of changes have been done. But these same changes have also happened in nursing education. So nursing education in higher medical colleges today, when we talk about that, is different. It is based on competencies. We have heard here about the importance of working with clinical practice. So for nursing education, the biggest change in Kazakhstan, in accordance of EU directives, is that half of the training is in practice. Nurses teach nurses in clinical practice. So the clinical skills are much different than in earlier education. During the trainings, we have trained 92 mentor trainers, and they have trained in every higher medical college, as well as in some of the medical universities, many mentors. And they have trained nurses or nurse students. Also an important issue that we have been doing since 2016 is the assessment of medical colleges. Medical college is an institution, and the institution's management is responsible of the quality of the education. In order to change from discipline-based education, what we heard that the universities are facing, medical colleges put themselves and wanted to show first their skills and change of teachers and give evidence on that they truly understand what is competence-based education, what what do EU directives mean? What are the clinical practices that must be in nurses' education? So during these years, annually were medical colleges assessed, and now 50 has been assessed. I can say that in the beginning there were deficits in the quality and understanding of competence-based pedagogy and the European Union directives, but in the last round we saw already that a big change has happened. The medical colleges were well prepared and provided documents that they really had put in practice all the required changes. And at the moment there is 30 medical colleges that has been assessed, and we can see that the impact is that in every single region except one, there is now a medical college who understands what is competence-based pedagogy, what it is required for mentorship, how to arrange the clinical practice. So you have every tools in medical colleges to arrange applied bachelor education. One big issue has been the modernization of the state educational standards for nursing. Those documents are the key of having a unanimous educational standard for all your major working force. During the years, we started and did actually first time the college level educational standard. We made a small change in 2013. We added health promotion. And actually you're asking, has anything happened? I can say that the impact in medical colleges, teachers, is that when we worked and were developing the applied bachelor nursing standards, I could my own eyes see that the teachers had understood and they became empowered. They took responsibility of developing the curricula and the subjects. Every single semester when we helped them to design the education better, they were participating and preparing issues. Now there is opportunity for 3.5-year education, and also the fast track is developed. Academic bachelor education standard was already designed together with high universities 2017, and now the fast tracks have been made. We can see that there is evidence on that the public image even is raised. There is applicants to universities now when there are opportunities for career development. There is the master educational standard that was renewed last year, and the PhD. There is the future for total lifelong learning path for your nursing staff. And these last two, they should be your teachers. You heard in the beginning how big amount your ministry wants to have new nurses. It means that there should be a big amount of masters and PhDs to guarantee the quality of medical university staff and the education and the research. You need to invest as rectors and management of the universities to these positions and educations. Here you can see already we have 16 graduates from our joint master program with Kasmunjo. We have 2 cohorts there. There will be next year more of these enthusiastic new masters who can use English in their writing, who know what is the level of international master degree. And our consortium work is not only the World Bank project, it is much more. We have during these years, from 2015-18, had mobility grants over 100,000 euros, where EU has supported your staff and students to come to Finland. We have Erasmus capacity building project ProInca, where comes to Kazakhstan €500,000 from EU to support the structural change of your medical universities to ensure the collaboration. The aim is to build a center of nursing excellence. Astana Medical University has taken the lead in that they want to be the center of nursing excellence, the ones that coordinate all the knowledge sharing. This should be a shared platform. You all should give to this center, then you will have the best opportunity to transmit all the information needed for nurses to practice. But what's then in the clinical practice? We have not forgotten those. We are helping you to create the clinical practice guidelines. These will help your nurses with extended practice to practice based on latest evidence. There is already 6 ready and 7 on progress. Here is already 70 trained trainers of 4 different clinical nursing guidelines, and they are, you see, on those core issues where you have the chronic diseases, the disease management programs. Now it's the question how your practice will just take these to use. And for every single university, how much you use these in your education, are they used? That impact I cannot say. I don't know what you're doing, but please take this as a serious issue. There will come more. And then the management system and the positions of nurses, they have been changed. There is now the new nurse with extended practice. So please talk about new standards, new nurse with new competencies when you talk about nurses of future. Do not talk about old nurse and the previous types of nurses, but see to the future. That is what your healthcare system needs. There are organizational structures. We're trying to give and help you in all possible ways to create international standard nursing management systems, because nurses should be and nursing led by nurses as they should be taught. But what's the future? I have a dream. Here you see, this is Janjaya. Janjaya is a master's student. She studied the image of nursing in Kasmunio. Her results say that the applied bachelor graduates believe that the image of nursing is better in 2030 when there is 40,000 applied and academic bachelor nurses. These young nurses are ready to do research. In ProInca, we recognized by Delphi study that the main interest areas are emergency care, stroke and heart failure, health promotion. They are the same that you have been talking all the day. What are the core? Oncology nursing, sorry, I forgot. They are the same core that you said that your university's main research area are. They are also for nursing research the main areas. Here are graduates of an Nazarbayev University, new nurse managers of UMC, the new managers who want to, and they raise their thumb up. There will be a new management system led by nurses. They are ready to, they develop the job descriptions. They are ready to start. Here is Jamilia. She says, I want to be PhD. There is a dream. They just wait for the changes to become. They are ready. Are you? Here is Olga. It's 2 weeks ago. She said, I am the future. So I really think that there is a time for change. Every single you have in your medical college, in your university, nursing education. Please take it into your strategy plans. Give it like a good, timely plan and plan your staff development. They want to study. There is 100,000 nurses who want to be retrained. It's just a matter of giving them the opportunity. Thank you.